Hello, I'm Dr. Libia Scheller. I'm the Medical Director at the Institute of Medical Education and Research, and I'm happy to have today Dr. Emmanuel Antonarakis, who's an Assistant Professor of Oncology at the Johns Hopkins Sidney Kimmel Comprehensive Cancer Center. Thank you so much for joining us today.
Thank you.
Can you tell us a little bit about your background and where you are today?
Sure. I did my medical training in Wales at the University of Cardiff. I then moved to Baltimore, Maryland, where I did my internal medicine residency at Johns Hopkins, where I stayed for my oncology fellowship, and have completed my fellowship about 2 years ago, and I joined the faculty as an assistant professor of oncology focusing on prostate cancer and drug development in prostate cancer.
One of the things we're so grateful for, we just finished doing a video Viewpoints on prostate cancer, and you were the chair of this. Can you tell us a little bit about the activity, and after that, the importance of all the multidisciplinary team in participating in this educational event?
Sure. So in this activity, first we outlined the currently FDA-approved agents for prostate cancer, some of which are very novel, many of which have unique mechanisms of action that we're not used to talking about. We then actually looked at those FDA-approved drugs and some of the experimental drugs and tried to put that all together and discuss in some of the case studies at the end how myself and some of the other faculty members on the discussion would manage those patients. And for me, it was actually very interesting having another medical oncologist as well as a urological oncologist, a urologist by training on the panel. I think that was very important, hearing the perspective from both people, not only the oncologist who traditionally manages these patients, uses some of these drugs, especially the chemotherapy drugs, but also hearing from a urologist, not necessarily because the urologist might be prescribing the chemotherapy, but just hearing about the decisions of when that patient would be referred to an oncologist depending on their stage, and also just to hear their perspective about all these new drugs and how they think about these drugs.
And it's very exciting times in the area of prostate cancer. Can you tell us a little bit about the challenges that this multidisciplinary team faces today?
Right. So as you mentioned, the best way to take care of these patients is in the multidisciplinary fashion. I think one of the great challenges for me is, well, now we have 4 new drugs, maybe a 5th new drug that improves survival, all in the time span of maybe a year and a half. And we have all this new data, but none of us really know exactly how to use the drugs, how to sequence them, which drug to use first, which drug to use second. Do we have to give people breaks off of one drug? Does one drug actually interact or interfere or compete with another drug? So it's great that we have all these agents, but frankly, even medical oncologists in the academic centers struggle with some of these issues, and often we just have to sort of use our best judgment and talk to our colleagues. And to me, that's really an opportunity where I like to talk to other oncologists in my institution or from other leading academic centers, and also from urologists to hear about how they're managing their patients, what they're doing in their institutions. So I think we have a lot to learn.
So this video Viewpoint really highlighted where we are today in the treatment with the NCCN guidelines, but also what's coming in the future. And I think this is 2011. We're going to seriously see a lot in the coming year and next year, because we have quite a few phase 3 trials going on right now. So thank you so much for this, and we look forward to seeing a lot of more data coming out of the phase 3 trials in the near future.